Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I answered another question from one of our readers where the reader said, "My husband is in ICU for 4 months. Can he go home with intensive care at home?" You can check out last week's question by clicking on the link below this video. In today's question, I want to focus on another question from one of our readers. And Mandy says, "My husband has been in ICU since January 2020 with pneumonia and a stroke. He's got a tracheostomy and he can't come off the ventilator. We are stuck. Can we go home with intensive care at home?" So here is what Mandy writes. "Hi Patrick, my 63-year-old husband went into ICU earlier this year with severe pneumonia. He then suffered from a stroke a couple of weeks after being admitted into ICU. After he suffered from the stroke, he ended up with a tracheostomy and a PEG. He's been in ICU since the 6th of January. He's slowly weaning off the ventilator but has poor muscle movement due to all the medicines he was given. I would like to bring him home with intensive care at home care. He's already getting severely depressed, not being able to talk right now as he can only manage a couple of hours here and there to stay off the ventilator. Me and my children are spending day and night in ICU in order to be with my husband, and he's not making any progress at all. The ICU says it'll be very difficult for him to come off the ventilator, and they say that it might be best if we let nature take its course and let him die. We don't agree with that at all because we know he wants to live. We can accept if he can't be weaned off the ventilator and the tracheostomy, but we can't accept him staying in a sterile ICU environment. What are our options?" From Mandy. Well, thank you, Mandy, for writing in and for sharing your situation. I can totally understand your situation. I have worked in intensive care for 20 years and I have seen situations like your husband over and over again. And obviously now with what we're doing with intensive care at home, it does make a lot of sense to get your husband home as quickly as possible. And not only is it going to be better for your husband to leave, as you said, the sterile intensive care environment, it'll be also better for, his quality of life, of course. He'll go back into a more natural day and night rhythm because, as you would have seen by now in ICU, there's never any peace and quiet. He probably would have a disturbed day and night rhythm, probably can't sleep properly, probably has ICU psychosis and ICU delirium on top of the stroke. Now, the other thing is obviously with yours and your children's situation, you are spending day and night in intensive care, and I'm sure it impacts on your whole life. You probably can't work. If you were working before, I would imagine it impacts on your children's life. And I can only understand that you and your children want to be with your husband 24 hours a day. That's how important your husband is, of course, and we understand that perfectly well. And so looking at what are your options, I mean, you're saying that he can't be weaned off the ventilator at the moment, and he's struggling with that. And we don't know whether we can wean him off the ventilator at home or not, but we can certainly keep trying. Now, keep in mind, in a depressing and sterile ICU environment, I believe it's not the right environment anyway to focus on weaning. At home, it will be so much easier and also so much more patient and family friendly because your husband will be in the comfort of his own home. We are sending intensive care nurses into the home 24 hours a day to focus on the care that your husband needs, but we can also focus on the weaning. We can focus on the mobilization part of things. You can get physiotherapists coming into your home, occupational therapists, potentially speech therapists. If your husband can stay off the ventilator for a little bit longer, maybe he can start with speech therapy, and that's when he needs a speech therapist as well. But The bottom line is this, your options are to leave intensive care as soon as everything is organized. We can focus on getting all the equipment organized that your husband will need. We can focus on getting a 24-hour nursing roster together with intensive care nurses that are basically bringing the ICU into the home and that provide an intensive care substitution service for your husband and for yourself. That gets you out of the rut being stuck in intensive care. Now, the next question in a situation like that is obviously how can you obtain funding for our service, and I know you are in Melbourne in Australia, and especially now in Australia with the NDIS coming, with the NDIS having come in and having starting to fund nursing care, one of the avenues to access 24-hour funding for intensive care at home is through the NDIS, but it's not the only option. Department of Health has funded our service in the past as well. Another option is that our service can come in under a hospital in the home type of service, because you got to look at this from an intensive care perspective as well. I mean, as you would know by now, intensive care units are incredibly busy, and with winter coming up, they're only going to be much busier, and you don't want your husband being exposed to all sorts of infections in intensive care either. The longer he stays in intensive care, the higher the risk he will end up with another pneumonia, or he'll end up with another infection, and that could kill him, let's face it, And at home, the infection risk is so much lower because he's in his own environment. He's not exposed to any other serious bugs that he is exposed to in ICU. But coming back to what's in it for the ICU as well with our service, which will help you as well. So an ICU bed costs around $5,000 to $6,000 per bed day, right? And that is a significant expense. Intensive care beds are the most expensive beds in a hospital. And, with somebody being stuck in intensive care long term, the ICU is suggesting to you that your husband should die, but why would that be why should he die if he wants to live, especially with a service like ours being so readily available nowadays. So the question is not so much what does the ICU want. The question for you is, what do you and your husband want? But what we offer, ICU wants as well, because we can help them free up their bed. And as I said, ICU beds are in high demand, and as you know, surgery gets cancelled all the time. Some patients have to be referred to other hospitals because there are no ICU beds. So what we're providing really is a win-win situation for everyone. We get your husband home, he can improve his quality of life. We help you to leave ICU as well. We improve your quality of life. We free up an ICU bed that costs $5,000 to $6,000 per bed day, and we can provide an intensive care substitution service in the home for about half of the cost. So again, it's all about creating that win-win situation. And again, on top of all of that, your husband is in an environment where there's much less risk for an infection. So thank you for watching this video, and I hope, Mandy, this helps. You know where we are. If you have a loved one in intensive care with long-term ventilation and tracheostomy needs or any other medical complexities, you should also contact us on one of the numbers on the top of our website, or just simply send me an email to patrick@intensivecareathome.com. And if you are an intensive care nurse or a pediatric intensive care nurse and you're looking to get out of the craziness of an intensive care unit and work for us in a much nicer and more holistic and client-centric family environment, you should contact us as well, and you should check out our career section on our website. We have currently vacancies for experienced ICU and pediatric ICU nurses in Melbourne, on the Mornington Peninsula, in Warragul, in the northern suburbs in Melbourne, and also in Sunbury, so really all across the Melbourne metropolitan area, including country Victoria. And you can escape the hustle and bustle of intensive care and work in a much nicer and much more family-friendly and holistic environment. You can also have a look at our service section, where we detail exactly how we deliver services or tailor-made services, I should say, for our patients and their families, but also for hospitals and intensive care units. We have also been part of the Royal Melbourne Health Accelerator program in the past for innovative healthcare companies. Thank you so much for tuning into this week's blog, and I'll talk to you in a few days. This is Patrick Hutzel from Intensive Care at Home.